At times, life can seem to become more challenging and hectic for some of us. This presentation was developed to encourage you to reach out to fellow partners when they demonstrate the need for help and support. These expressions of concern contribute to a supportive workplace culture. A key to improving emotional health and removing the stigma of mental distress is to make the signs and symptoms recognizable, understandable, and most importantly, in the workplace environment, manageable. When someone experiences an injury or illness, the signs and symptoms are clearly recognizable. In fact, they are often difficult to miss and clearly inhibit the tasks a person can do. When someone experiences emotional distress or psychological ill health, the signs are not so obvious unless we look a little more closely. To help us improve our ability to recognize those in distress and provide them the support they need, we have borrowed a concept from physical health care. If someone is very unwell physically, they are taken to an intensive care unit or ICU. They are monitored closely so that they are able to stabilize and hopefully return more rapidly to health. When people are emotionally distressed, they are often not recognized as being in ill health by those around them in the workplace. Emotional distress is most apparent in the way people's behavior changes, and often people are thought of as disruptive or withdrawn rather than unwell. They are left feeling alone and unsupported, adding to their distress. With their concerns unacknowledged, they begin to feel no one cares and they drop out further. Members of their workplace team may ignore them or shut them out since they are less effective and difficult to work with. To prevent this from happening, we want to improve our ability to notice and respond to others' behavior and feelings in our workplace. This reinforces our values that each and every person counts and that people matter, both which support a healthy HEB culture. The initials ICU thus become the phrase I see you. You do not need to be a doctor, nurse, or counselor to reach out to someone on your team. All you need is a way to recognize who needs help and direct them to where they can get it. There are 3 very simple steps to I see you. Identify the signs. Connect with the partner. Understand the way forward together. First, identify the signs. Notice if anything has changed in the person's behavior. Is she tired? Is she distant? Does she seem sad? Does he seem irritable? Has he withdrawn from the team and his colleagues? Next, connect with the person. Find a quiet place to talk. Be non-intrusive. Simply ask, I've noticed that you're not your usual self. Is there something wrong or is something upsetting you? Is there anything I can do to help? Finally, understand the way forward together. Most people can relate to the experience of never having anyone really listen, and so listening in itself can be a tremendous help. However, some people will need some additional support. HEB's Partner Guidance Program provides free and confidential resources that offer this kind of assistance. Encourage someone in need to reach out and use these resources to get help. As you assist others, know that services are also there to support you, should you need help as you aid your colleagues. By remembering the letters I see you, you reduce the risk of people feeling alone and worthless, going unnoticed, and becoming more unwell. I see you is a simple way for us all to remember how to help and respect others and improve the emotional health of our colleagues every day in the workplace. When you see this symbol, remember the 3 simple steps. Identify the signs. Connect with the partner. Understand the way forward together.